And I now recognize the ranking member for questions.
Thank you. As ranking member of the Select Subcommittee, I've long called for a forward-looking approach to preventing and preparing for future public health threats that applies the lessons that we have learned from the COVID-19 pandemic. Emerging public health threats are not bound by our borders, meaning that this objective is as important for our engagement with the international community as it is for our domestic efforts. Reforming the World Health Organization to insulate it from political pressure and strengthen the international community's response to emerging public health threats is central to this mission. So I'd like to begin by asking each of our witnesses, with respect to the United States global health engagement in reforming the WHO, what is the single most important lesson that we should take away from the COVID-19 pandemic? Let's start with you, Assistant Administrator Guande, then we'll move to the left.
Thank you. Number one lesson from COVID, I think, is that in crisis, U.S. leadership is indispensable. First, we are often the first in, and then we bring others along. A case in point is the U.S. providing more COVID vaccines without charge than any country in the world, with 700 million vaccines. But then we also supported COVAX as a mechanism that then got other countries to do their share. We came in early with funding first, but the net contribution of COVAX was even larger in the end. There are multiple other examples in the ways we led on oxygen capacity and building that out in places that didn't have capacity for oxygen in the face of a respiratory virus, around antivirals being distributed. American leadership works because when we lead, we pull in partners and allies with us. We demonstrate the values of global collaboration and harnessing collective national security. And American engagement with the WHO has been essential to our effective global response as a result.
Thank you, Ambassador Nguyenga-Song.
Thank you, Congressman. I think the number one lesson from, I believe, or one of the lessons from the COVID-19 pandemic is that a disease threat anywhere in the world is immediately a threat in the United States. It took only 2 months for COVID to spread to 165 days, 2 months. On January the 4th, there were just about four countries in the world that had reported COVID. But by March 20th, about 165 countries had reported COVID. So it tells us the story of our common connectivity, a common vulnerability, and the inequalities or inequities that we have to address. In all of this, I think the lesson that follows from there is our leadership is important. Our leadership in making sure that we are engaged, proactively engaged, so that such a threat, when it occurs and anywhere that it occurs, we squash it before it becomes a threat in the United States.
Thank you. Assistant Secretary Pace.
Thank you, Ranking Member Ruiz, for this question. My colleague, Assistant Administrator Guande, touched on the importance of the international health regulations. And when it comes to lessons, I think we can think of it in a couple of different ways. First, as he mentioned, there are ways that we as HHS are working to amend those international health regulations, not only through the alert system or improvement of that system that he described, but also thinking of ways to give WHO flexibility to share the information that they see or receive by other means. So I believe the chair as well spoke to the limitations with regards to countries if and when they choose to be transparent with us. In the event they are less than transparent with WHO, WHO actually has other means to understand the situation, perhaps by other sources or other publicly available information. But they might hesitate for fear of backlash from that country if they get ahead of them. And then that country essentially retracts and isn't a partner in the response, or otherwise continues to be more opaque in what they share or less than forthcoming. And so what we're hoping to do also through these amendments is make it so that WHO has permission, so to speak, to notify other countries around the world if and when they give certain actors a chance to provide what they know, and those actors just don't respond. We just essentially don't want to be in the dark, and that's why it's so important to work in this way on these IHRs.
Thank you. The State Department and Department of Health and Human Services have also been representing the United States in the ongoing pandemic agreement negotiations, which are generating recommendations for member states to promote cooperation on preventing, preparing, and responding to future pandemics. Ambassador Nukengasong, what steps is the State Department taking to advance the United States' interest in global health leadership in the ongoing pandemic agreement negotiations?
Thank you. The State Department is working very closely with our colleagues from the Department of Health and Human Services to support our team, negotiating team in Geneva. And it is very clear, as you rightly said, that we need this instrument, a pandemic accord, or pandemic agreement, that would protect us. I mean, if you ask me to summarize that in one line, I would say it is an accord that will do the things that we have been discussing here, which is allow us to detect early, respond early. A threat that will emerge and invariably will emerge because we all know that we live in an era of pandemics. So we're actually looking at ways we could continue to work with several countries, more than 190 countries around the table negotiating this. It's not a fast process, but it's a necessary process. We have to be at the table and continue to show leadership in the way we work with countries to share sequences, share viruses when the threat arises, and share, of course, the medical countermeasures. I think that is central to our ability to protect ourselves. Imagine if a virus or an unknown virus emerged in any way in the world where we don't have access to that. I mean, we rely on this kind of an accord or agreement to have access to those specimens, sequences, so that we can develop a diagnostic test, vaccines, or therapeutics.
Assistant Secretary Pace, how will the framework of the recommendations in the pandemic agreement apply lessons we learned from the COVID-19 pandemic to advance international pandemic prevention and preparedness?
Well, certainly, this potential agreements would do quite a bit to complement what is already in place, such as the international health regulations. One of the shortcomings, unfortunately, of the COVID-19 pandemic is it did not allow for a high degree of accountability when it came to accessing innovations in particular. And one of the things we are trying to negotiate as part of this agreement is to ensure that those innovations reach everyone, including Americans, on time. As the ambassador mentioned, that involves sharing samples and data so that we can actually produce or manufacture these innovations. In other words, spur R&D, essential R&D. But then there's a question of how these innovations reach people around the world. That isn't just a moral question, but it's a strategic one, frankly. Because in the absence of vaccinations, for example, we had the opportunity for variants to emerge and thus kept us in this ongoing fight against COVID. So it's our hope that this potential agreement helps to, again, sort of buttress what we are able to do at a more technical level with regards to pandemic preparedness and response.
Thank you. And as negotiations for the pandemic agreement have been underway, there have been some misrepresentations of how this treaty would square with the United States sovereignty. Ambassador Nukengasong, could you please help us understand, correct the record regarding these misinterpretations?
Thank you, Congressman. Let me say up front that that has not at all been a subject of discussion during the pandemic accord or agreement. We will not allow such, if ever such a discussion was to occur during the negotiation, I can assure you that we will not allow it to happen. As a matter of fact, when you look at the draft that is circulating, the draft pandemic accord agreement or instrument, on Article 3, Section 2, clearly on the principles, clearly stipulates and affirms the importance of the sovereignty of the countries, that it is the countries themselves that have the right over their people. I think that is very clear, Article 3, Section 2 of that. So I think the misinformation or disinformation is unfortunate. It's at all, the accord has absolutely nothing to do with the sovereignty of our country.
Thank you. And now that we have closed the chapter on the darkest days of the COVID-19 pandemic, we must dedicate our efforts to ensuring that the United States is leading the way, as you have identified as one of the biggest lessons learned, in preventing and preparing for the future public health threats, which requires an international response that will allow access, transparency, and data to contain an emergency virus in the host country with full cooperation of the host country in order to prevent it from spreading elsewhere. I think that should be our singular focus as a global community, wherever this virus may arise, even if it arises in the United States, to really have international cooperation to prevent, because that's how you're going to prevent the next pandemic. Thank you, and with that, I yield back.
Now recognize Ms. Malley.